Well, the senator from Massachusetts is still with us. I just want to say a couple of things. One, good for you. He just said a mouthful, and he said what needs to be said. And what he said is there's not just one or two courses. Somebody said to me yesterday, well, it's a choice between either a single payer or between Graham Cassidy. Those are our choices. No. I think a far better choice is for us to take the example of leadership set by Senators Alexander and Murray and the Committee on Health, Education, Labor, Pensions. They held, in the span of, as the presiding officer knows, in the span of 2 weeks, 4 bipartisan roundtables with governors from all over the country, insurance commissioners from all over the country, healthcare providers, insurers, health economists, to say, what should we do? What should we do right now faced with the challenge and maybe the possibility of repealing the Affordable Care Act? What should we do? They all said the same thing. Stabilize the exchanges. Every state has a health insurance exchange, the individual marketplace, stabilize them. And they all basically said to do maybe 3 or 4 things in order to stabilize them. Number one, make it clear that these cost-sharing subsidies are for help lower-income people in the exchanges for their copays or deductibles. Make it clear they're not going away. Make it clear they're going to be around for at least a couple of years. Number 2, they said make sure that we have either to give the states the ability to create their own reinsurance plans or create one for the federal government, by the federal government, involving the federal government. The third thing they said is if we're not going to enforce the individual mandate, I personally think we should, but if we're not going to, then make sure there's something that's just as effective as the individual mandate, to make sure that young people, millennials like my sons, are getting their health care. They're in the exchanges, and they're helping to make sure there's a healthy mix of people to insure. Those were almost word by word, panel by panel, what we heard in 4 different hearings by the Help Committee, 4 different roundtables that preceded, bipartisan roundtables that preceded those hearings. They all said, fix the exchanges. I have an old friend, now deceased, Mr. President. He was a Methodist minister for many years in southern Delaware. And he used to give me this advice when I was governor. He'd say, just remember this, Tom. The main thing is to keep the main thing the main thing. That's what he said. First time he said it to me, I didn't know what he's saying, but it took me a while, and I finally figured it out. The main thing is to keep the main thing the main thing. And right now, the thing that we can do and ought to be able to agree on is to stabilize the exchanges. Premiums don't have to go up in the exchanges by 30, 40%. And if we would simply do one thing and make it clear that these cost-sharing subsidies aren't going away, give that green light to the insurance companies, they will reduce significantly. Insurance commissioners across the country will reduce significantly the increases in the premiums. I've been told by more than a few health insurance companies, if we would do that and make sure there's some kind of reinsurance program in place, in effect, and also make it clear that if the individual's mandate continues to be enforced, and if it's not, replace it with something that's just as good. If we'll do those 3 things, we can see premiums go down anywhere from 30 to 35% in the exchanges across the country. Who benefits from that mostly? Who benefits from a 30 or 35% reduction in premiums in the exchanges? Well, the folks who are getting their insurance in the exchange benefit to some extent. But you know who else probably benefits even more? Uncle Sam. And the reason why is because most of the people that get their coverage in the exchanges benefit from a sliding scale tax credit that buys down the cost of the premiums. And if the premiums go down by 30 or 35%, that means Uncle Sam out of the U.S. Treasury pays less money in the form of those tax credits. That's not a bad deal. That is not a bad deal. Our Republican friends like to talk about dynamic scoring. I'm not sure I really believe dynamic scoring is real, but I believe that if we actually do help drive down the cost of premium increases, Uncle Sam is a big beneficiary of that. Last thing I want to say, well, maybe 2 things. One, I want to just thank Senator Alexander. I want to thank Senator Murray for the great leadership, bipartisan leadership that they've shown. Had a chance to go to for the bipartisan roundtables a couple of weeks ago. They welcomed people not on the Health Committee, I'm on the Finance Committee, and along with the presiding officer and a bunch of folks who serve on finance, we have shared jurisdiction, as he knows, with the Health Committee. But we have the opportunity in our committee to sort of follow the lead, if you will, of what they're doing on the Health Committee and do bipartisan hearings and maybe some bipartisan roundtables of our own. But why don't we sort of pick up where we were about a week and a half ago when the prospect of debating and voting on Graham Cassidy came almost, for some people, out of nowhere and led to yesterday's 5-hour hearing in the Finance Committee. Why don't we pick up where we left a week and a half ago and get to work again? And this is not something we ought to take weeks or months to do. Let's just do the main thing, and that is stabilize the exchanges. And if you do nothing else, maybe the next week or so, let's make it clear that these cost-sharing subsidies are not going to go away. Not going to go away. We help the people in the exchanges. The premium increases come down. We actually help the Treasury. It's not a bad deal. Last thing, Mr. President, I want to say is, for those people who, some people say, well, Democrats believe that the Affordable Care Act is perfect, nothing needs to be changed. That's just nonsense. I could, and the presiding officer and I, we could sit down and tick off a number of things that ought to be addressed and ought to be fixed. He and I are probably as smart as we are and smart enough to figure out all of them. We need to have good hearings and good conversations amongst ourselves and with a whole broad section of shareholders, stakeholders across the country. And as a recovering governor, former governor of Delaware, former chairman of the National Governors Association, I want to hear the voices of the governors. I want to hear the voices of the insurance commissioners and a whole lot of other people who are affected by this. Every president, I think, since Harry Truman has called for providing health care coverage for just about everybody in our country. Every president. And along the way, we've made some advances, Medicaid and Medicare, Lyndon Johnson. We made some advances in the Clinton administration with Orrin Hatch and Ted Kennedy's legislation creating the CHIP program, Children's Health Insurance Program. But we still are a long ways from where we ought to be. Healthcare coverage in this country, here's if you will, the trifecta for where we would like to go and where presidents and leaders have said forever we ought to go. Number one, provide quality health care for the people in this country. Number two, do it in a cost-effective way. And number three, cover everybody. Well, we're doing a lot better job of covering everybody. We still have 20 or so million people who don't have health care coverage. That's down from maybe 50 million a couple of years ago. We still have people that don't have coverage. We still spend a lot more money as a percent of GDP for health care in this country than most other advanced nations. And we have to continue to figure out ways to get better results for less money and have a real focus on value. And there's actually a lot of encouraging work going on in my state. I know in Ohio, places like the Cleveland Clinic, places like Christiana Care in my state. There's a lot of encouraging work going on. And we ought to build on that. Find out what works and do more of that. And last thing, Mr. President, I want to give a shout out to Senators Gary Peters and Senator Duckworth, Stabenow, and myself and a couple of others who have been focused on a veterans health motion to commit. And I just want to say a few words about health care as it pertains to veterans. We sometimes get this has been lost in the shuffle. The Medicaid program in our country covers about 20 to 25% of the people who get health care in this country, Medicaid. Medicare is about 15%. The majority of people who get health care coverage in this country get it through their large group plan. And we have maybe 6 or 7% who get their coverage through the exchanges. As a veteran, a Navy veteran, Ohio State Navy ROTC guy all those years ago, retired Navy captain, we know that not every veteran actually gets their health care coverage from the VA, and a number of them aren't eligible for doing that. As it turns out, among the people who receive coverage under Medicaid today, a lot of them are old. A lot of them are like our parents or our grandparents or our aunts or our uncles. And the reason why they're eligible for Medicaid is because they spend down their resources, their assets. They're old. A bunch of them have dementia. And maybe the family's unable or unwilling to take care of them. And they end up in a nursing home, and Medicare picks up the tab. This is like, I described it yesterday in our Finance Committee hearing, it's like a tsunami. Because what you have is my generation, the baby boomers, are moving toward their retirement, and moving into their 70s, 80s, 90s in some cases. And a lot of them are old, and they have dementia. A couple of million of them are veterans who get their health care coverage through Medicaid. And you have in Ohio and other places like that, and certainly in Delaware, we have huge problems with opioid and heroin. And the biggest form of treatment, as the presiding officer knows, is for people with drug addiction in this country is Medicaid. So those are some reasons why we think it's important not to never touch one hair on the head of Medicaid, if you will, but to try to figure the changes that we make them in a smart and humane way. Let me just say a word or two about veterans' health care. My understanding is the last version of the Republican health care proposal that was pulled today, not to be voted on. I'm told it cut several hundreds of billions of dollars from Medicaid. I believe most everybody says that is true. Not every veteran, as I said, has access to the VA for health care. Nearly 2 million veterans, as I mentioned earlier, it's about 1 in 10 veterans in this country rely on Medicaid for their health care, and that includes some 6,000 veterans that are living in my own state of Delaware. The Affordable Care Act provided health care coverage to some 340,000 veterans in the states that expanded Medicaid, 340,000 veterans just in the states that expanded Medicaid. And for our veterans who rely on Medicaid, the most recent Trump Care proposal would significantly scale back benefits or cause them to lose their benefits altogether. And veterans who rely on those benefits would see higher health care costs and lower quality care if they can access it at all. And all the while, we know that veterans are at a higher risk for serious and complex health care issues because of our service. I just want to close by saying heartfelt, we all know veterans. We have an obligation to those who served us to make sure that we take care of them later on in their lives. We do that in a variety of ways. The VA system is much maligned. In my state, they're not perfect, but I think they do a darn good job. And we have one big hospital in northern Delaware and 2 community-based outpatient clinics, one in Dover and central Delaware and another in the southern part of our state. They do a very good job. We're about to open a brand new 10,000 square foot community-based outpatient clinic in Georgetown, Delaware, the county seat of our southernmost county. And having said that, not every veteran in Delaware can access those facilities. And for them, Medicaid is useful. In some cases, it's critical to their having any life at all. Let's just keep that in mind. And as the challenges or focus are created by the possible vote here on this floor now averted on the Cassidy-Graham proposal, let's keep in mind as we go forward in a bipartisan way, work together to fix the things in the Affordable Care that ought to be fixed, to preserve those which should be preserved, and the aspects of it that ought to be dropped. Let's figure out how to do that in a smart and humane way. It also keeps in mind that a couple of million people who use Medicaid are veterans themselves.